This video will be about warts, or as fancy people like to say, condylomas. More specifically, this video is going to be about genital warts, or as fancy people like to say, condylomata acuminata. In order to get an idea of its size, warts are usually around the size of a pencil eraser. Regarding their shape, warts will have the appearance of a cauliflower. Now, the big question. You get warts by being infected with the human papillomavirus. Now to the next question. How do you get HPV? And you get HPV from sex. On TV shows, a character will be sitting with their significant other in the doctor's office. When the diagnosis of HPV is given, the partner will cry out how they've been together for weeks and that the character cheated on them. It is after this outburst when the doctor makes the point that the warts usually take at least a month to appear, and more often than not can take 2 months. Are there other ways? Well, any way that results in you touching an infected person's genitals. I mentioned warts are usually the size of a pencil eraser, emphasis on usually. Warts can be bigger to the point that they can block the release of urine and stool. Things that will make warts larger consist of a weak immune system, diabetes, and smoking. So do your best to manage your stress, watch what you eat, and to quit smoking. So, we mentioned warts are caused by HPV. Now I should mention that there is more than one type of HPV, and unfortunately, some types are more likely to cause cancer. Right, so a lot of rashes due to STDs can look like warts. How do we know it's actually warts? A doctor can tell based on the rash's appearance, such as characteristics listed here. If a doctor is uncertain, they can take a piece of it and look at it under a microscope. A household test that's not very useful. Vinegar makes warts turn white, but vinegar makes a lot of warty things look white. So this little at-home test gives you a little idea of what you have is actually a wart. Okay, so what can we do about it? We wait for about 4 months. Other 2 out of 3 will usually take about 2 years. Most people don't want to wait for various reasons as listed here. Treatment options. If they're too big, then you will have to go with surgery. But let's discuss if the warts are small enough for other options to be considered. People will usually go with the surgical procedure because it's the fastest way to get rid of the wart. The con to keep in mind is that there's going to be scarring. For this reason, people prefer liquid nitrogen. If you don't want surgery or the scarring, then there are ointments. There's the strong stuff that only physicians have access to that will work faster, and there's the weaker stuff that will work slower, but patients can apply them on their own in the privacy of their bathroom. Alright, so let's wrap this up. So most people will get HPV at some point in their lives, around 75%. Condoms and the HPV vaccine can lower the chance of you being infected by HPV. Something to keep in mind is that if you have recently contracted warts, then there's a 5% chance you might have contracted another STD as well. I'm sorry to say that even when the warts are gone, HPV may still be in the body. This means that the warts can always come back. And remember, things like weak immune system are a factor, and a person's immune system will become weaker during times of stress. Lastly, wait until the warts are gone before resuming sex in order to minimize the chance of transferring the disease onto others. So, thank you for watching.